Good evening. Hello, 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 good humans. I hope your week has started good and you're doing well, you're staying healthy. My name is Lydia. My channel is Lydia's Way. Welcome back for video number 2. And I'm going to start by first introducing to anybody who's new to my channel. Welcome to my channel. My channel is about uplifting, inspiring, learning something, and also just sharing from my experiences raising a son who has very many medical needs. He has spinal muscular atrophy type 1, and so he has very many medical needs, and he's now going to be 8 in November. And so after many years of just drilling into caregiving, I felt it is time for me to try and find some purpose in all this. So this is it. So welcome to my channel. I had promised, so I'll start by asking for your forgiveness, because I had promised to do a video. The next video would be on relationships, and then we can follow that with SMA. But I thought to backtrack just a little bit, because on my first video I really went into detail and explained to you the importance of or the value that I as a nurse have been able to benefit just from being a nurse in how I care for my son. Now, of course, there is a flip side to that, and so I thought it would be unfair for me to just move on and not give the other side of being a healthcare person, taking care of a child with complex needs. Now, these videos of mine are not in any way to diminish any parent taking care of a child who has medical complex needs who is not a nurse. No, this is just Lydia's way, sharing Lydia's experience with a background of healthcare, which has been rather very influential in how I raise my child. Okay, every parent is truly doing the best for their child. Just I had a mashup of being a nurse, so I thought to backtrack on that and give a little bit. So let's go in. So my first challenge was, it's very, it comes off the, it's very obvious sometimes that doctors don't believe you. And in my case, it took a while to even get the child's diagnosis, my son's diagnosis, just because the doctors don't believe or don't want to believe or are not listening to you in earnest. And so you will find that resistance, just nobody believes you, man. Nobody just takes your word at what you're saying. And this is quite true even to other parents. But as a nurse, even when you explain it, in detail, exactly with signs and symptoms and all this objective information, it still will take a minute for someone to believe you or providers to believe you. So I found that I was a little taken aback by that, and it took me a minute to understand that. But it will happen that doctors will not believe what you're saying or will not take your word. And I do try to come from a point of letting them know I'm not here to antagonize what you bring to the table. I, on the contrast, know and appreciate that I can't do what everybody else does. I can't be their respiratory therapist. I can't be a phlebotomist. I am not a doctor. I am not an x-ray tech. I am not any of those specialties. And so I appreciate what everyone brings to the table. And so when I go in and when I'm dealing with the healthcare providers, I come from that point and let them know I'm not here to antagonize what you're doing. I truly do appreciate it, but I will ask questions. I will ask for repeat. I will be more inquisitive. What are the labs? What are this? What the X-ray? I might want to look at it. So it's not coming from a bad place. It's just coming from a point of care, and I'm just advocating for my child, and sometimes that can be taken the wrong way. there is a general notion that healthcare workers can be a little bit rude, but it's not that way. I found that if I come from a point of them understanding that I'm not antagonizing your efforts, then I do get collaborative teamwork in the end, okay? You could say that you won't reveal you're a healthcare person in any way, but maybe an x-ray result or some labs or something, you will ask a question, and the ingraining in you of being a healthcare person, I would sometimes explain or ask a question in medical jargon. And even if I had to say I didn't reveal I am a nurse, it just pops out. And so you could say you won't reveal, but at some point something will pop up, and the explaining in medical terms is just quicker to pass your point across than just using not, because it's just a part of you. So I found that I even if I say I won't reveal, it will still come out at some point. Now, the other thing about being a nurse that I struggled with is that, when you're pregnant and you're carrying a child, by the time you give birth to them, you've already kind of mapped out or seen, what life would be. You've planned for school, maybe what types of school or daycare centers you want the child to go to, or what type of preschool or kindergarten. You've already mapped out those things, and then you get a child, and very early you get drop bombed with this diagnosis that is altering, and so you have to find a way to delete those milestones. So in my case, because I am a nurse, I think what stressed me most is knowing the uphill battle my son has in terms of trying to meet the milestones and if he will meet them, but then also switching off that I am a nurse. I was very intentional to switch off PEDS milestones, because then I don't have the pressure of comparing where he is or where he ought not to be. If he meets the milestones, he meets the milestones. And you will find in my posts, I do say a lot, there are inch stones that become milestones, little by little that become milestones. And so in his own timing, him and God agree, we are going to wake these muscles up, we're going to wake these nerves up. And so in his own timing, wherever he meets the milestones, I'm happy with that. I take it and I run with it. I hope that switching off that PEDS milestones bit for me was very beneficial. It was the one way I found that I would deal with not having expectations of anything and just being able to relish and appreciate the little milestones my son is able to meet without comparing them with anything. Now, I have been very blessed to be able to have a nephew, and I have been able to watch the milestones that a child should be hitting through him. So that has been very beneficial for me to reacquaint myself. But truly, right now, if you ask me a child who's 8 years old what they're supposed to be doing, in terms of typical milestones, I might hesitate to give you. I might need to do a little bit of reading so that I can give you accurate information, because I have truly deleted it. And it's not in a bad way that deleting, it's just help me manage expectations, help me appreciate and live in the moment to be able to appreciate the little milestones my son hits without comparing them to anybody. He is him. He is going to meet his milestones when he meets them, and I don't have any pressure for him to meet them. When he meets them, I am very happy. I rejoice. I am very glad. And so having to switch off, it can be a little bit challenging for parents to be able just to switch that. But then it still will linger, what life your child will have in the future. I still think about those things. But in terms of the milestones, at least I've been able to switch off the knowledge of knowing what milestones are and just be able to appreciate and relish and live in the moment and not have expectations or pressures put on him for anything. So I that has been very helpful. The other thing is jobs. Now, as a nurse or a healthcare worker, sometimes you get in the grind of working, and it becomes very hard to call out. I struggled, my people, good humans, because I used to work I'm not the people to call out. I work diligently. Man, it took me a long while for me to make peace with the fact that my employer will find a float person. My son will not find a replacement of a mother. So if my son needs me, then I do need to be here. There is support like family leave, medical leave of absence, FMLA, but still just it took me a while to be able to just internalize that my son needs me and I have to be there for my son. And so if I do need to call out, then I will call out. And if I have to use the FMLA, then I will use the FMLA. And when I tell you I struggle with that, I really did. And it used to stress me and give me headaches. And every time I have to call out, I'd have palpitations. I'm so anxious about it. But at some point, I had to switch it off and say, my son needs me. And there is nothing I can do about it, but my son needs me. So I have to call out. I have to take this leave of absence. And I have had been very fortunate to have providers who have signed those papers for FMLA, because it can be a process if you don't have supportive providers, and they have been able to understand where I'm coming from and be able to sign those papers. But on the other side of that, it is important to understand that at some point you might be let go, because the productivity at work is not equal to the for me. I ended up having too many days off than I was on the job. Okay, remember they're providing health insurance. Now these are things that I think of in hindsight. When I was going through that grind, it was not even funny, let me tell you. But I was laid off. I was let go, quite literally, and they might put it in professional terms. But if the truth of the matter is that I did take days off to care for my son. Ain't nothing I can do about that. If there is no nurse, I have to take care for my son. I can't abandon. If we have to go to hospital, I have to go. If he is in hospital for a procedure, we have to go. If there is appointments, I have to go. But you have to realize that at some point, they will not tolerate it and you will find yourself being let go. And so that it got to that point for me, and I had to leave employment. The beauty about being in nursing also is that there's so many specialties, and so you can kind of move around. I started off in ICU, and then it became too much. I moved down to like a cardiac step down, and then still not coping, I went to a transfer center, where the backside of nursing, where you facilitate patients moving in and out of facilities. And then that was a work from home job. It went well, but they needed us to go back to the hospital in office. And then I moved to triage, and triage I left now when I was let go. And so now I'm in home health, and I work for a wonderful organization that has been able just to meet me at my point. And I work when I work. I'm able to make my own schedule, and so that has been very beneficial, just to be able to jump around like that and be able to find some sense of balance with taking care of my child and not neglecting him, and just being there for my child, and also being productive at work, because for me it's important that I work, not only just for the benefit of money, but also for my mental health, that I am productive, that I am not redundant. So for me it's important that I work, but then also I'm able to get insurance for my son. So there's many benefits. It's important for me just to work. So it has been beneficial just to be able to jump to move around, have the flexibility to move around and find something that works for you. Okay, now the other side of being a nurse is it can be challenging to be a nurse and have nursing in your home. And you will come, I have had to appreciate that these nurses come to my home to take care of my son. Nobody can quite take care of him the way I take care of him, and nobody can quite do things the way I do them. And so that is one expectation I had to dial down. And so when I get a nurse, I will take you just as you are. I will ask what you know, But then I would remember that you know, but you don't know taking care of my son. So you can change a trick. I'm good with that, but I would want you to change it on my child. And so I am very diligent in how I communicate with the nurses. I keep it very open. I keep it very calm. I keep it very gentle. I am very, very patient. I'm a very patient trainer. And so I will train you from what you come with to where you are, because sometimes again, nursing is very specialized, and this person coming into home health could be coming in for many other reasons, but they could have had the background of oncology, nothing to do with peds nursing. So I have to take the time to train them up. I had a nurse who took care of my son for a while, and she had come from a memory care home, and so she had zero understanding about peds nursing. And so I had to start from scratch, everything from scratch, invasives, equipment, ventilator, cough. I had to start from scratch. I couldn't assume she knows, and it took a while. She was very willing to learn also, and it took a while to bring her up to speed. But when she did, she was one excellent nurse. She did leave because my son ended up getting nursing through the school district, and so we had to let her go. But I do know that the effort that I put in for her has helped her. The next patient was able to benefit. It's important when any nurse who comes to your home, they wouldn't know anything, and even if I know they know, I'll still train them like they don't know, and I'll start from scratch, and I'll be very patient. And so that is one aspect where nurses can struggle, because it's your child and you know, but this other person does not know. They need grace, they need patience, and they need training, so they can take care of your child the way you would want them to take care of your child. And even if it's not 100%, so long as they can meet you at 70%, I'm happy, man. I don't complain. I'm just happy because at the end of the day, I have been able to work this long because I have had the help of nurses. We had one nurse who just retired this summer, and she had been with my nurse since my baby since he was 9 months old. So you have to dial down your expectations, and you have to remember to be graceful, to give grace, to be patient, and to keep repeating these things again and again and again. The training you will need to repeat again and again and again. So that side, it can be very intimidating for also that nurse coming into a home where they know the mother or the father or the parent is a healthcare giver, and sometimes it can be antagonizing because they know, and you're telling them this is not how it's done. I want it done this way. And that's why I said you have to come from a point of grace, a point of patience, a point of understanding that I know and I appreciate that but I'd like it done this way for my child. And usually that goes well. You just have to be patient with it, and you have to learn to repeat the same things again and again and again and again and again. Alrighty. The other part I struggled with is when you go to the hospital, like when you go to the ER. I wish the providers would listen to the parent of a child with medical complex needs more, because for me, I will already have dialed it down. First of all, it takes a minute for me to go to the ER, because that is just JAMS department. And so I will think it takes a long while, and I will try and do very many things outpatient before I can ever get my son into the ER, because it's just jams, and you might go collect things that you didn't have or you are not wanting and bring them home again and make the situation worse. So by the time I'm going to the ER, I almost have dialed it down to a T. It is just that I don't have the x-ray here, I don't have the lab here, neither do I have the certification of a doctor. And so when you go to the hospital, you already know exactly what you want. And so I have to be very clear with the doctor. I'm not antagonizing, but this is exactly what I want you to focus on, because I know this little human, and I'm trying to get this checked out, because that's from the many things I've done. This is where I think the problem is. Now, usually, the few times we've been there, the doctors have listened and kind of picked up on that and ran with it and use that. But sometimes you'll find a provider who's not willing because again, you think you know, but it's truly just from a point of advocating for the child. And if the provider would understand that, actually it would make their job very easy, because I already have down, I can give you 3 already differential diagnoses. I've already thought about it before I came in. So I have found that it can work for you or it can work against you. It just depends on who you meet. And I've been fortunate to meet providers who listen, and amongst their way, what they consider could be wrong with my child, they will take my input and also work with it to see what if what I thought or anything comes of it. At the end of the day, I just want the best for the child, and I'm hoping, and if we can collaborate and synergize and not be antagonistic, then that works at best. Now, so that is the flip side of being a nurse or a healthcare worker for me, I have found. And it can be a little challenging in terms of how you relate, but I usually will put it out there. I'm coming from a point of appreciation on what everybody is bringing to the table. I'm coming from a point of just being very thankful that I have all these specialties that can take care of my son, and so I'm not antagonizing what you're doing. If anything, I want us to bring put our brains together so that we can get diagnosis quick, treatment quick, and get out of the hospital quick. And if it is outpatient, then I'll ask the questions, and if you listen to the input, then we can come up with a plan of care that works for my son best. And usually I have found that if I come and explain myself that way, the doctors will understand and care for myself. The other thing I'm going to add on is it is important to have one doctor in your corner. For example, we see the pulmonologist a lot, because there's a lot of care for my son, is a lot of respiratory care, and she has been fantastic because she has been able to find a balance between Lydia the mother, Lydia the nurse, Lydia the caregiver. And sometimes she will just put me in my place and tell Lydia the mother, I need you to take a corner seat right there and listen to me. And so she has her own way of doing it, and we've worked with her now for as long for 7 years now, and so she has dialed it down to a T on how she picks out all those things from the mark of what I am saying. And we can be able to, she can either put me in my place, she finds a way, and I know what she's doing, and that works great, and then we are able to come up with a plan of care. But the point is that in the first place, she listened to what I was saying. So if you can find yourself a few of those providers, and like I said, it comes again from just them understanding that you're not trying to antagonize what they're doing. You're not trying to, cause a power struggle. No. You're not trying to say you know it all. No. I want your input. Just listen to me, so that we can collaborate synergistically and come up with a good plan of care that works for the child or the family member that you're caring for. And so the flip side of nursing, I wanted to cover this because I felt it was important, because I had just covered the good side of being a nurse. There's also this flip side. And if you or have been with a family member and you're a nurse or a healthcare worker in any way, put your experiences in the comments. Let's see what people have experienced. Or have you had positive, negative? Have you had providers who understand you? So that we can see our experiences, share experiences, and somebody else might pick up something that will help them along the way. So that's it. And so the next video that I pick up now will be on relationships. I'll continue on with the trend, and then I'll cover SMA, because that has the bulk of information that I want to pass along, because that will lay the foundation of everything else that I do and explain here on this channel. Alrighty, now if you have not subscribed to Lydia's Way, what you waiting for? This is the channel where you get the truth about healthcare. You will learn something about caregiving, and you might pick up something that you will use for yourself or a family member, or in healthcare if you're in healthcare to help a family, another family somewhere. Please subscribe to my channel, like my channel, share my channel, and let us grow. If you have any comments, put them down there. If you have any questions, put them in the comments, and I will check in and I will give you a reply. Alrighty? Thank you very much. Have a good week ahead, and we shall see you on Friday. Bye bye.